Hi, my name is Sierra McCray and I'm a nursing student at Cedar Crest College. This is my Nursing 332 Evidence-Based Practice presentation. For my presentation, I wanted to review the use of music therapy for improving cognitive abilities in patients with dementia. The reason I selected this topic was due to the fact that music therapy has been used to help with anxiety and agitation and pain management. I wanted to see if there could be a relationship between the use of music therapy for improving cognitive abilities in patients with dementia. So I posed the question: in persons over the age of 65 with dementia, does music therapy versus no intervention improve cognition? The significance of the problem is that the older population is growing, and with its growth is an increase in the number of individuals that have been diagnosed with Alzheimer's disease worldwide. There needs to be a non-pharmacological intervention put in place that can be used at the bedside by nurses as well as in the community setting. Something that's non-invasive and cost effective. For the process of the literature search, I use the CINAHL database as well as Google Scholar and Google. I use key terms like dementia, Alzheimer's disease, cognition, music therapy, nursing, research, and analysis. I used limitations from 2010 to present, and I used articles that were completed within the United States. For my synthesis of the evidence, I used 3 different articles. 2 were systematic reviews, and the other was an observational study. One of the systematic reviews was done by Fang et al., which wanted to support the use of music therapy to decrease cognitive impairment in patients with Alzheimer's disease. The other systematic review was done by Guess, who wanted to show an improvement in cognition and memory with the use of music therapy. And the Wagner and Mason observational study wanted to show a relationship between the use of music therapy and memory for patients with dementia. The findings of each study show that in the Fang et al. Study, that patients can improve cognition with the use of music therapy in Alzheimer's disease patients. The Guest study showed that with the use of different types of music therapy techniques, there could be an improvement in the quality of life for individuals with Alzheimer's disease. And in the Wagner and Mason study, it showed that there was an increase in the level of awareness in dementia patients when music therapy was incorporated into the patient's plan of care. Recommendations from these 3 studies suggest that music therapy should be used as an assessment tool when patients are first admitted into a facility. Nurses should use this intervention at the bedside as well as in community settings or home care settings. That each patient that has some form of dementia should use music therapy for 45 minutes at least 45 minutes a day, and that family members and healthcare providers should be educated on the importance of incorporating music therapy into the care of patients that have Alzheimer's disease or dementia. In conclusion, music therapy is an effective intervention that should be utilized by nurses and caregivers and families to promote safety, self-awareness, improve cognition, and the quality of life in patients with dementia or Alzheimer's disease. I hope that you found this presentation to be informative, and I look forward to answering any of your questions in the discussion forum. Thank you.